if you're taking omeprazole for severe GERD, is that going to block all nitric oxide? So in a pursuit to always let you guys know that I'm not just pulling this out of my butt when I'm talking about some of this stuff. So first, let me show you why it is that we even have an issue when we take omeprazole. So here's what I'm going to do. I'm going to take this picture, which is from this great article that I'm going to share with you. And I'm just going to show you here. PPIs, that is your omeprazole or your proton pump inhibitor. What you're looking at here is the process of nitric oxide production using the L-arginine pathway, right? So we got L-arginine, we use nitric oxide synthase to help us make nitric oxide and L-citrulline. So what's happening here, though, is that as part of a byproduct of that, we have ADMA. Now, ADMA stands for asymmetric dimethylarginine. And the problem with ADMA is that it is not a good thing. It is not something that we want hanging around in the body. And unfortunately, because of the proton pump inhibitors, see this red part right here? Omeprazole actually blocks this dimethyl aminohydrolase right here, this DDAH. It actually blocks the ability to break down this ADMA. And ultimately what happens is we have so much ADMA floating around, and unfortunately, high levels of ADMA are associated with diabetes, heart disease, because ADMA actually can interfere with your blood vessels' ability to do what it needs to do, which is expand and contract, right? So that's ultimately why proton pump inhibitors become kind of detrimental to this process to create nitric oxide. So with this being said, I want to show you very clearly, very clearly here, that here's one of the first articles that kind of found that this was an issue. So it's called The Unexpected Effect of Proton Pump Inhibitors and the Elevation of Cardiovascular Risk Factor, ADMA. So this is kind of this was years ago, I think this was 2013, where they first realized that proton pump inhibitors were interfering with nitric oxide production and elevating the risk of cardiovascular disease, right? So that's one thing. Then the next thing is, this is just a great case study that was published back in 2021. Now, this is about a young man who started taking Prilosec or proton pump inhibitors for his reflux and basically ended up with a massive case of erectile dysfunction. This was a healthy guy, and he started taking omeprazole, Prilosec, Protonix, whatever you want to call it, and he ultimately ended up with erectile dysfunction. And the reason is because of what we just discussed, because the proton pump inhibitors or the Prilosec interferes with your body's ability to make nitric oxide, but then on top of that, it further causes damage to the lining of your blood vessel, making it very difficult for it to do its job. Because remember, part of the process of expanding the blood vessel, part of the process of lowering blood pressure, part of the process of increasing blood flow throughout the body is relaxation of the blood vessels. And the blood vessels cannot relax if that ADMA is too high, because it destroys the body's ability to continue to use L-arginine to actually relax and contract, relax and contract. So with this omeprazole issue, erectile dysfunction is just part of it, because also what it's doing is increasing the risk of cardiovascular disease. And this whole article is about basically saying that maybe we need to start telling patients that when they're taking Prilosec, Protonix, acid blockers, things like that, that there is an increased risk of erectile dysfunction with it.